Good day, nurses. Now let's discuss your Glasgow Coma Scale. So when we say your Glasgow Coma Scale, this is a neurological assessment tool used to measure the person's level of consciousness after brain injury, trauma, or neurological condition. Usually, ang ating Glasgow Coma Scale or the GCS is commonly used in critical area such as your ICU, your trauma units, and even ERs. So, dun natin siya usually ginagamit. Si GCS natin, we have three components. Okay, may tatlong components tayo. We have the eye opening. Okay, we have the eye opening, the verbal response, and the motor response. So here in our GCS or in Glasgow Coma Scale, we assess the level of consciousness of our patient. By how? By introducing or by introducing stimuli. Okay, what are those stimuli? It can be verbal or pain. Okay, it can be verbal or pain. Dito, when we introduce verbal or when we introduce pain to our patient, we can assess their level of consciousness. Okay, so here in our three components, dito natin malalaman kung ano bang level of consciousness ng ating pasyente. So when we say eye opening, the highest score will be 4 and the lowest score will be 1. In our verbal response, ang highest score naman natin dito is 5 and the lowest score will be 1. Sa motor response natin, 6 ang highest score and 1 ang lowest score. Walang 0 sa score natin dito pagdating sa ating GCS. Unlike sa ating Apgar scoring, may 0. But here, dito sa ating GCS, wala tayong 0. The lowest score will be 1. Okay, so if the score of your patient is 15, okay, if ang score niya is 15, it means this is a best response. Okay, when we say best response, your patient is oriented, awake, and alert. Okay, your patient is awake, alert, and oriented. If the patient, okay, scores is 8 below, the patient is in coma. Your patient is in need of intubation. Okay? Kailangan natin siyang i-intubate. Okay? If the score is 3, the patient is in deep coma. Okay? In deep coma. If the patient score is in between 13 to 15, it means that the patient has a minor brain injury. Okay, if the score is in between 9 to 12, the patient is in moderate brain injury. And if the score is between 3 to 8, the patient is in severe brain injury. Okay, so it's in brain injury. So again, let's start our eye opening. Sa eye opening natin, 4 ang highest score. 4 is spontaneously. It means pag nakita mo ang pasyente mo, spontaneously ino-open at nako-close niya ang kanyang mata, automatically 4 ang score. But if ang patient mo, nakita mo close ang mata niya, at to speech at sinabi mo siya, "Sir, can you open your eyes?" At pag open niya, the score will be 3. If ginawa mo to at hindi niya inopen ang mata niya, gagawin mo naman to introduce pain. Magbibigay ka naman ng stimuli. Okay, in introducing pain, meron tayong dalawang types. In introducing pain. We have the central stimuli and the peripheral stimuli. Okay, we have the central stimuli and peripheral stimuli. Okay, sa central stimuli natin, may tatlo tayong types. Okay? May tatlong types tayo ng central stimuli natin. Okay, yung first stimuli natin with this one. This one is called or also known as your supraorbital pressure. Okay, supraorbital. Kasi sa mata tayo, okay, yung mata ng pasyente mo, prines mo. Okay? Nagbigay ka ng pressure. Yung pressure na yan can give pain to our patient. Next natin, we have your trapezius squeeze. Okay, your trapezius squeeze. Okay, yan naman, mag-i-introduce ka ng pressure in between, dun malapit sa back, sa may shoulder and back ng neck ng pasyente mo. Okay, yung pressure can give pain to our patient. And lastly, we have your sternal rub. Okay, your sternal rub natin, mag-i-introduce tayo ng pain dito sa sternum ng pasyente natin. But this sternal rub, bihira na lang natin siyang ginagamit. Bakit? Kasi it can cause hematoma and bruises to our patient. That's why bihira nang gamitin ito. Kaya ito na lang ang ginagamit natin. Your trapezius and your supraorbital. Next natin, you have your peripheral. Sa peripheral stimuli natin, ang ginagawa natin sa peripheral stimuli ganito. Okay? Kumukuha tayo ng ballpen and nilalagay natin sa nail beds ng pasyente mo. Yun, ang pressure na yan can give pain to our patient. Okay, ganyan tayo mag-administer ng stimular or ng pain sa ang pasyente natin. So to pain, kapag once na ginawa mo yun, yung mga pain na yan at nag-open yung eyes ng pasyente mo, 2 ang score. But, ginawa mo na to, okay, ginawa mo na yung 2 speech, ginawa mo na yung pain, pero wala pa ring response ang pasyente mo, automatically, the score will be 1. Next natin, we have the verbal response. Sa verbal response natin, 5 will be the highest score and 1 will be the lowest score. The patient, if the patient is oriented to time, persons, and location, automatically the score will be 5. So ask some questions such as what's your name, what's your birthday, the month, the year, or kilala mo ba kung sino yung mga kasama mo? Aware ka ba kung nasaan ka ngayon? Alam mo ba kung anong time ngayon? Anong date ngayon? If lahat ng yan ay nasagot ng pasyente mo, it means she or he is oriented. It means the score will be 5. If lahat ng yan tinanong mo at ang sagot ng pasyente mo ay hindi siya sigurado, unsure siya sa mga pinagsasabi niya, she or he is confused. It means the score will be 4. If tinanong mo yan at ang pasyente mo kung ano-anong words ang mga lumalabas sa bunganga niya, for example, mga words na wala namang meaning, words naman na walang ganun sa dictionary, automatically the score will be 3. If nagtanong ka sa pasyente mo pero incomprehensible sound, it means tagmo-moan lang pasyente mo. Usually nakikita to doon sa mga matatanda, di ba? Na pag nagtanong ka, ganun lang yung word nila, that is 2. If walang response, walang sound na nilalabas or pinoproduce, again, the score will be 1. Next, okay, motor response natin, obeys command. Okay, for example, sa motor response natin, tine-check natin dito yung galaw. Okay, movement. Okay, obeys command, sa binabi mo sa pasyente mo, binigay mo yung dalawang mong kamay, hinawakan mo yung dalawang kamay niya, and then sasabihan mo siya, Ma'am, sir, squeeze mo naman yung kamay ko. Pag in-squeeze niya yan, automatically 6 ang score. Or ask your patient to raise his or her hand. Taas mo, galawin mo yung paa mo, galawin mo ulo mo. Pag ginawa niya yan, automatically 6 ang score. If the patient, okay, nag-introduce ka ng pain, for example, ginawa mo si trapezius squeeze mo, okay, tapos ang ginawa ng pasyente mo, nilagay niya yung kamay niya doon sa kamay mo at inalis niya yan. Winidraw, inalis niya to. Ang score ng pasyente mo ay 5. But if ang ginawa mo, si trapezius squeeze at flex niya or tinaas niya yung kamay niya, pero hindi niya natanggal yung kamay mo at hindi niya nahanap kung saan ka nag-introduce ng pain, the score will be 4. Next natin, we have your abnormal flexion and abnormal extension. Your abnormal flexion is also known as the corticate. The corticate. And this one is the cerebrate. Okay, your decorticate and decerebrate. Kung mapapansin natin si decerebrate, 4 yung E niya. 1, 2, 3, and 4. E, extension. Okay, anong pinagkaiba ni decorticate and ni decerebrate? Ganito si decorticate and decerebrate natin. Okay, this is decorticate, this is decerebrate. Flexion, extension. Okay, kung mapapansin natin, flexion, extension yan. So, kapag once na nag-introduce ka ng pain, okay, nag-introduce ka ng pain at ang position ng kamay ng pasyente mo ganito, that's the corticate. It means meron ng damage sa kanyang cerebral hemisphere. The score will be 3. Okay, but if you introduce pain and your patient nagkaroon ng decerebrate posturing, okay, ginanito niya lang yung kamay niya, that is abnormal extension. It means meron ng damage sa kanyang midbrain. Okay, the score will be 2. And if ginawa mo ng lahat, wala pa rin response ang pasyente, automatically 1 ang kanyang score. So, si decerebrate and decorticate natin, si decerebrate is the more severe. Decerebrate is more severe, decorticate is less severe. Decerebrate, poor ang prognosis. Okay, poor ang prognosis natin pagdating sa decerebrate. So, ganyan mag-assess ng level of consciousness ng pasyente natin. Ganyan gamitin si Glasgow Coma Scale. Let's try to analyze and identify the Glasgow Coma Scale nito. So, we have the eye, verbal and motor response. Okay, tingnan natin. A 30-year-old male is brought to the ER after a motorcycle incident. He opened his eyes only when his name is called. Okay, open his eyes when his name is called, speak in confused sentence, and tries to pull away when nurses apply a painful stimulus. So, tignan natin. Open his eyes when his name is called. So, ang score natin dyan, to speech. So, 3. Next, confused. Ang score natin is 4. Okay? Next, try to pull away when nurses apply painful stimuli. So, that is 4. The score will be 11. Okay? Yan natin siya, to speech, confuse, and moves to localize pain. So, 3 plus 4 plus 5. That's 12. 3, 4, 5. Bakit 4? Motor. Flex. Tama. Okay, that's 4, 5. It's 12. Okay, it's 12. Ito, dapat si motor natin is 5. Okay? May 5 dapat to. It's 5. So, the score will be 12. Next natin, a 24-year-old female was in a minor car incident. She is awake, alert, open her eyes spontaneously, talks clearly, and obeys all command. So, eye-opening natin is spontaneously. The score will be 4. Okay? Next natin, the verbal. verbal natin, okay? The verbal, she is awake, alert, okay? So, ibig sabihin, automatically, the patient is, okay, alert and awake, oriented yan. Okay? Okay, talks clearly pa siya. So, the score will be 5. If motor movement, obey all commands, the score will be 6. Ibig sabihin, the score 15. Best response or the patient is alert, awake, and oriented. Next, 58. Sorry, a 58-year-old male collapsed at home. He opens his eyes to pain and makes incomprehensible sound and localize the pain by pushing away the examiner's hand. Okay, so to pain, tignan natin. To pain, it's 2. Then incomprehensible sound, 2. So 2 ang score, plus 2, and pushing away the examiner's hand. Move to localize pain. That is 5. So ang score ng pasyente natin, it's 9. And last, a 70-year-old female was found unconscious. Okay, after a fall. She does not open her eyes, makes no sound, and shows abnormal extension to pain. So she does not open, 1. Makes no sound, 1. Shows abnormal extension, that is decerebrate, that's 2. So the score will be 4. Sorry, it's 2. Score is 4. So ganyan mag-check or mag-score ng ating Glasgow Coma Scale.